Hi, my name is Brad Kegley. Today I'm going to be doing a IV insertion. First thing I'm going to do, I'm going to check my doctor's orders. The doctor has ordered a 22 gauge IV to be inserted into the patient, and this time I'm going to be going into the supply room to gather all my supplies for this procedure. And into the supply room, I have my syringe and needle. I'm going to connect these here. I have my alcohol prep. Going to clean the top. Going to draw up 3 milliliters of air. Push in. I'm going to have the needle off. I have my INT right here. I'm going to connect these two together. I'm going to make sure and clear the INT. No bubbles. And close that off right now. I'm going to gather the rest of my supplies before I go into the patient's room. Alright, going into the patient's room. Hi, my name is Brad, and we'll be doing a IV insertion on you today. The doctor has ordered a 22 gauge IV to be placed today. I'm going to come over to the patient. I want to go to the non-dominant side arm and make sure that the patient doesn't have any past surgeries, mastectomies, anything like that that would hinder me from going into this arm. I'm going to make sure that there's no tenderness or anything else in this arm, no pain. Patient denies any pain at this time. So I'm going to apply my tourniquet. Going to check for radial pulse, make sure that the tourniquet isn't placed too tightly. I'm going to get my alcohol pad. I'm going to clean the area here. Pick my vein out that I want. This one right here. I'm going to clean the area in circular motion. While that's drying, you can go ahead and put my gloves on. Alright. I can go here, get my IV ready. Okay. I'm going to go with the patient's arm here and pull tight on the skin. And I'm going to insert a 15-degree angle. Get a flash. I'm going to insert another 1/8 to 1/4 of an inch. I'm going to advance the catheter while retracting the needle. The catheter is in. I'm going to apply pressure above the catheter to the vein. I'm going to hook up my INT. I'm going to check for blood return. good. I'm going to use the push stop method and make sure that the catheter is inserted in the right position and flows good. I'm going to lock this there, place my Tegaderm. Get my piece of tape. Tape there. And I'm going to take this piece of tape here. We'll date, time, initial it, and place this on patient. Not in the way of being able to see the insertion site, and going to inspect, make sure that there's no redness, no tenderness. Check how the patient's feeling. Make sure that the patient is not having too much pain for the procedure that was just performed. And I'm going to go out and do my recording of the date, time, the route that the IV was placed, the arm that was used, and any complications that the patient had, which was none. And that will conclude my IV insertion.